Good morning, friends. Today we start the new topic for the purpose of the drug inspectors, assistant commissioner of the drugs. We started the syllabus one by one topics. Today we are taking the most important topic is the sexually transmitted diseases, and that topic almost cover 2 to 3 questions the drug inspector examination. So we need to study that point very carefully because this is a very tough point in the DI syllabus. There are about the 20 million new STD infection each year in the United States. We also seen that in the United States there are about the 20 million new cases is diagnosed each and every year in the United States. Hence you decided there is the various or a serious condition in the world of the STD. There are 20 type of infection spread by sexual contact. You know that there is a 20 type of the infection that is spread by the sexually. This often show different sign of infection or no sign at all. You can have a STD or not known it. There is that if a patient suffering from the STD, that is sexual transmitted disease, some of the patient no show any sign and symptoms of that disease at all. You can have an STD and not eat it. The bacteria we are the seen the STD that is curable in some cases, not curable in some cases. That we see are one by one. That bacteria STD, the sexually transmitted disease, that is caused by bacteria that can be cured with antibiotic. That infection is include chlamydia, gonorrhea, and syphilis. That's 3 type of infection is caused by the bacteria, and it will be treated with the taking a special treatment of the antibiotic. You cure by that disease, and also the viral disease that is the sexual transmission that can be managed and treated this infection, not 100% cure, but we are only treated and managed. That is a hepatitis, herpes, HIV, any HPV. That are the disease transmitted by the virus, and that we cure. So we know the how do you know if you have an STD? There is a some point we are taking in the point that we are suffering from the STD. Your health care provider can examine and test you for STD, right? Then your doctor or physician, it will be examine you and test your STD. Some men are at a higher risk of getting STD. You see that is some of the men that are the high risk in the STD. They should have regular exam and testing. Higher risk may include those who have had a previous STD. That the person visit the practitioner or that the family physician regularly. Who is those person? First is the have had a previous STD. That person have the suffering from the previous STD. Second is have a new or multiple sexual partner. That person have the new or multiple sexual partner. That person also regularly examine the STD. Men who have sex with the men, that person also examine. Use condom only some of the times, right? That person only use condom at the some of the times, and also have sex for drugs or money. That the professional worker, sex worker, that also use needles for illegal drugs, and the person that uses the drugs for a illegal purpose. This is by the way, we are know the STD and how to we are regularly examining the our physician going to the physician and examine the test of the sex STD. Those who are person I already listed, that person is taking the treatments. Next point, we are taking the how can men avoid the STD. How men can avoid the STD. That a STD disease only especially the men that can be avoided. First point is the avoid sexual contacts. Next is the this include vaginal, anal or sex or the genital touchings. This is the only way to be absolutely sure avoid STD, right? Have safer sex. Also reduce the number of sexual partners. Always is convinced and use correctly. Have sex with only one partner who does not have the sex with the other and does not have the STD. Also the limit and stop drugs and alcohol use of before the during sex. This is the how can men avoid the disease. We have seen some of the countries or also in our India there is one religions in the Muslim there is a circumcision is a there is a religious, right? The role of circumcision is a very important in a nowadays. The circumcision we are discuss on that point. The in that what is circumcision? First of all, we understand male circumcision is the surgical removal of the some of the entire foreskin covering the tip of the penis. Germs can grow under the foreskin and create hygienic problems. Hence, we in that main cases in the infant stage there the foreskin is removed. Why do men get circumcised? Parent made the decision when they have very infants, right? Religious, social regions, medical regions to prevent infection. There is a various regions. The benefit of circumcision. Research studies have shown the male circumcision lower the risk of acquiring HIV, genital herpes, human papillomavirus, and syphilis. That are diseases are prevented by the circumcision. Also, the penis cancer and over the lifetime, cervical cancer in life partner, urinary tract infection. The test. Uncircumcised men can speak with their health care provider about the how circumcision may impact disease and infection, how nurse may impact sexual sensitivity, benefit the risk of the procedure, who will perform the procedure. This is about circumcision. So now, in the next lecture, we are covering the point as a sexual transmitted disease by the bacteria, that is a chlamydia, right?